street, and this is one of our very largest packings ever. We're packing bags of hope, which are food backpacks for kids that would otherwise go hungry on weekends. 1 in 4 Arizona children struggles with food insecurity. That's 25% of our population. Upwards of 500,000 kids aren't sure where their next meal is going to come from. He looked down at his dinner plate and let tears roll down his face. Really, he cried at our dinner table. And he said, I watched her walk right up to a big black trash can, reach in. He said she pulled out a piece of pizza, and I can see some faces, some mom faces. And that was probably what mine looked like that night. I thought, how could this be happening in my city and I don't know it? That night, my husband said, all right, we have a hunger problem in our city. I think we should start a nonprofit to help these kids. I think we should call a kitchen on the street, and I think we should do it tonight. Our first year, we partnered with one school, and now we serve 2,000 kids, so we pack about 6,000 bags a month. It's incredible. We moved from our kitchen table to our backyard, to a schoolroom, then to a warehouse. We're making a huge difference academically in the classroom, and I have to believe that just by a healthier life and better education, then they're going to be a success outside the classroom too. During the course of our 5-year partnership with Do Good Live Well, that's equated to 210,000 meals for hungry kids, and make it possible for thousands of children to know they're going to eat this weekend. And to them, that truly turns hunger into hope. Do Good Live
Well! The title of my talk is Pregnant and in Jail, Structural Inequality and the Safety Net of Incarceration. My name is Carolyn Suffren. I'm an OBGYN and a medical anthropologist based at Johns Hopkins University in Baltimore, Maryland. I've been working on issues of reproductive health for incarcerated women for the last decade as a healthcare provider, a researcher, and an advocate. I want to start off by telling you about a woman whom I call Evelyn. Evelyn was initially a patient of mine and then someone who participated in some of my future research. And Evelyn was in jail 3 times during one of her pregnancies. And during one of those times in jail, she sat back and reflected to me, and she said, you know, everyone says I got arrested, but I got rescued. I was so sick, I didn't want to get high no more. I just wanted to be in jail where I knew that I could eat, I could sleep, and that even if it's not the best of medical care, I was going to get some type of care. She was in her 3rd trimester of pregnancy when she said this, and Evelyn's story is featured in greater detail in my longer research in my book called Jail Care. But briefly, I think that what Evelyn teaches us is that incarceration is complex, that there are connections to broader society that we cannot ignore. And even just very plainly and simply, there are pregnant women behind bars in this country. So what I want to talk about in the next half hour or so is just even that revelation. There are mothers and pregnant women in jail. So what do we know about them? And then what do we know about healthcare in jail, particularly for these pregnant women? And then finally, to tap into a little bit of what Evelyn was saying, which is this strange and unsettling desire for jail. The fact that Evelyn said she didn't really want to be in jail, but she did want to be there because she knew she would get some kind of medical care. So with these complexities in mind, what they all tap into, I think, is the intersection between the politics of mass incarceration, a phrase that many of you are likely familiar with, but we'll discuss in more detail, and also the politics of reproduction, 2 very charged phenomena that define our social landscape in the United States right now. And when they intersect, it tells us a lot about our society and about how we value women. What these questions also tell us about is about reproductive justice, or perhaps some might even say reproductive justice, and how this perspective is essential when thinking about caring for incarcerated patients, but also teaches us a lot about how to provide care for non-incarcerated patients. So who are the women behind bars in the United States? Of course, they are all individual women. Evelyn is an individual woman, but there are some trends that we can talk about and some numbers that are important to know. So the latest estimates that we have available from 2015 estimate that on any given day, there are nearly 219,000 females behind bars in this country. And there are about 2.6 million arrests of women each year. Most of these women are young women. They're young women who are taking care of children younger than 18. And so they're young women who are between the ages of 18 and 44, but they're not just any women, these are mothers. And so the consequences of incarcerating these women are far greater than just incarcerating the women themselves, because they leave behind children and families and communities that they are responsible for. Most of the women who are behind bars in this country are arrested for non-violent offenses. And these are largely related, not necessarily to their being hardened criminals, certainly not for committing violent crimes, but conditions that characterize their lives, conditions of poverty, homelessness, struggles with addiction and other untreated mental health issues, high rates of trauma and prior sexual, physical, or emotional abuse, limited employment opportunities, limited access to quality education, things that in the healthcare world we often think about as social determinants of health. And in fact, there are tremendous overlaps between these things that can contribute to poor health outcomes, but that also can contribute to women's involvement in the criminal legal system. And indeed, this was true for Evelyn. She had never been arrested for violent charges. Women have been disproportionately affected by the so-called war on drugs. Now, we know that our country has seen a tremendous increase in the number of people behind bars in the last 4 decades, and that everybody has been affected, but these trends have disproportionately affected some people more than others, and women are one of those groups. And women have actually been the fastest growing population among incarcerated people for the last several decades. In addition, it is a defining feature of incarceration for women and for men that there are racial disparities. And we know that Black women are more than 2 times as likely to be incarcerated than white women. And this taps into some harsh realities in general for incarceration in the United States. We have the largest and most expensive prison system in the entire world. And to give you a comparative scale, these are incarceration rates around the world. And the United States has a higher incarceration rate than any country in the world, even higher than some countries that we might think of as more, perhaps more punitive. But we rely on incarceration way more than any other country in this world as a means for social control. There's much written about our contemporary incarceration system, and we could spend hours, days, and weeks talking about all of these analyses and characteristics. But I think there are several key characteristics that stand out and that are relevant when thinking about caring for incarcerated people. One is the high cost, and it's estimated we spend at least $80 billion per year on prisons and jails. And that is not just how much we spend on it, but it's also important when thinking about the economics to remember that there actually are people who profit off of incarceration with the privatization of prisons and healthcare in prisons and jails. Our system is characterized disproportionately by people of color, and it is also characterized by high rates of recidivism, meaning that when someone gets released from prison or jail, there is a very high likelihood that they are going to return. And indeed, Evelyn had been cycling in and out of jail for most of her adult life. This is not a sign of a system that is necessarily working as a strategy for whatever potential intended goal there might be. And then it's also characterized by just its mass proportion, which is in part where the term mass incarceration comes from. And on any given day, it's estimated there are about 2.2 million adults behind bars. And that's a drastic change from 4 decades ago. In 1979, that number was closer to 500,000. And you can see in this graph here just what a sharp rise in that slope we've seen since 1980. Now, one of the defining features is the racial disparities in incarceration in this country. And this has tremendous deep legacies with other racialized phenomena in this country, even as far back as slavery as Jim Crow segregation, and as many have argued, including perhaps one of the more well-known scholars arguing this, Michelle Alexander, the legacies of Jim Crow segregation now are replicated in the ways that our criminal legal system disproportionately treat Black people with incarceration and more harshly serve sentences on them. And this graph shows you that incarceration rates are much greater for Black individuals than for white or Hispanic individuals. And also that the rate, if you look at the slope, the rate is steeper over the last 2 decades for Black individuals than for white individuals. And a vast body of research has shown that these racial disproportionalities are not due to differences in committing crimes, but are systematic problems with our criminal legal system and institutionalized racism in how policies are enacted. And we can see that through drug-related crimes. We know that Black individuals and white individuals have equal rates of drug use and involvement in low-level drug offenses, but Black individuals are 13 times more likely to be imprisoned for drug-related crimes. And although they represent 14% of the overall U.S. population, they represent nearly half of the incarcerated population. And so the racial disparities are just indisputable and are representative of larger disparities in the way our society is structured. So now I want to come back to start to transition to women and reproduction and how all of this mass incarceration fits in with the framework of reproductive justice. This may be a framework that many of you are already familiar with, but for those who aren't, reproductive justice is a framework of understanding and also for action that recognizes the economic, social, and political power and resources to make healthy decisions about our bodies, sexuality, and reproduction. That these are core features of reproduction. And this was pioneered by the organization Sister Song, as well as the pioneering organization Forward Together. And reproductive justice is a perspective that is focused on a broader vision of rights than the traditional reproductive rights movement and sees broader structural forces as shaping women's abilities to make these healthy decisions about their sexuality and reproduction. And so the components of reproductive justice involve promoting and having the rights to have children, the right not to have children, and also the right to raise your children with dignity and safety. Now, mass incarceration directly intersects with this. And in fact, mass incarceration contradicts all 3 of these tenets of reproductive justice, as we'll talk about for the rest of this discussion. But briefly, the ways that mass incarceration disrupts these aspects of reproduction. Well, in terms of the right not to have children, we know that incarcerated women have limited access to contraceptive services, even if they were already on a method of birth control when they come into custody. They usually do not have the ability to continue that method. They also have limited access to abortion if they are pregnant and don't want to be. And that is something that is unconstitutional, but still happens. So mass incarceration interferes with women's right not to have children if they don't want to, but it also interferes with their right to have children. It incarcerates women during the prime of their reproductive years. Remember, most of these women are between the ages of 18 and 44. And so if they're behind bars during that time, that will limit their ability to have children when they want to. In addition, there are also instances in the very recent past, as recently as July 2017, of women in jails and in prisons undergoing coercive contraceptive measures, including sterilization. And mass incarceration also interferes with the right to raise children with dignity and safety. It siphons money from the communities and into prisons and jails instead of into making our communities safe and supporting broad social safety net services, access to quality education. And also if women are separated from their children, they're not able to raise them. So mass incarceration is a reproductive justice issue. Now, switching gears a little bit to think more specifically about the public health perspective and healthcare for prisoners, there are ways to think about it that remind us of the connections between the community and the prison or jail. And people have lives before they become incarcerated. And what we know about their health status is that pre-incarceration, many people have poor health status, and this relates to the social determinants of health and inequalities that often characterize their lives. We also know that the people who are cycling through our criminal legal system in prisons and jails are medically underserved. And one study has found that over half of them lacked any healthcare coverage before they came into prison and jail. So they have a lack of access to healthcare before they become incarcerated. Now, while they become incarcerated, some people talk about how this is a moment of opportunity. And I'll tell you why I have that word in quotes in just a moment. But here people are interfacing with a healthcare system. So all prisons and jails have some version of a healthcare system, although as we will discuss, it is highly variable. And so it may present an opportunity to diagnose people with new conditions, new medical conditions. For women, that may even include pregnancy. And for many women, jail or prison might be the first time they learn about a new pregnancy. Being incarcerated also can potentially prevent opportunities for preventative health care, both for general medical care and also reproductive health care, such as family planning and helping women plan for healthy pregnancies or prevent pregnancies they don't want for when they get released. But also what we have seen and what the data show is that prisons can also be health hazards. If people are in a place where there is inadequate or dangerous, neglectful medical care, prisons can make their health worse. People may have limited opportunities to exercise, and the access to proper nutrition is often limited. So obesity is a growing concern for people behind bars. In addition, there are many other factors that contribute to unsafe conditions for people. And that includes the medical and mental health conditions and the traumatization and the psychological impacts of being incarcerated in and of itself. And then there's also the moment to think about of release and reentry into society, because most people will eventually get released into society. Unfortunately, as you know, based on the high recidivism rates, many of them will also be rearrested. But that moment of release is really essential for enabling continuity of medical care. But when people get released, they often have competing priorities besides their health care, finding housing, reconnecting with their families, employment, reinstating various benefits. So there are a lot of challenges to that moment of release. But we know that the time of release from prison or jail is actually a very dangerous time. It's a very vulnerable time. And one study out of the state of Washington found that prisoners getting released from prison had a 12 times, nearly 13 times greater odds of dying within 2 weeks of release when compared to similarly matched controls in the community. Some of the most common causes of death in this group were drug overdoses leading to cardiac events, homicide, and suicide. And if they go back to the same communities where we don't invest in the safety net and other services, and we don't help them prepare for reentry, then their reentry is only going to perpetuate their disparities. Now, I put the word opportunity of incarceration in quotes because while it is true that people are interfacing with a healthcare system while they're incarcerated, we should not forget that they're still being incarcerated. They're still in a place of punishment. And prisons and jails are not hospitals. They're not clinics. They're not mental health hospitals. They are prisons and jails. And so the fact that someone like Evelyn might say, you know, things were just so bad, I wanted to go to jail so I could get some prenatal care and a place to rest, that is deeply problematic. And again, diagnoses the deficiencies of what exists in society pre-incarceration and how these people's lives are valued, or rather devalued, pre-incarceration. And so when thinking about the notion that Evelyn brought up, that jail could potentially be a safety net, which again is problematic, that there might be an opportunistic moment to provide health care to people, that notion, which again does not exist for everybody in the criminal legal system, but that notion that jail could potentially be part of the safety net, that rests on understanding some key differences between prisons and jails. And often we hear in our popular culture, prisons and jails talked about interchangeably, but they're actually very different. So even just administratively, jails, and there's a picture of a jail on the left, that's the San Francisco jail where I worked for 6 years. Jails are under county, city, or most commonly county jurisdiction, and jails are located in the communities where people live, or at least the communities where people get arrested. They are located right in the heart, if it's an urban center, but of the city. And usually, if someone gets arrested, they're going to go to jail first. And the majority of people in our nation's county jails are pre-trial, meaning they have not been convicted of anything. And most of the people are there, and this is especially true for women who are largely there for nonviolent offenses because they can't afford their bail. And so, again, the intersections between poverty and incarceration are profound. But because people are coming in and out of jail, and the connections with the community, that's why it's easier to see the connections and the deficiencies of the community by understanding what people like Evelyn go through in jail. Prisons, on the other hand, and there's a picture of one on the right, a women's prison in California. These are under state or federal jurisdiction. And people who go to prison are there because they are serving a sentence, usually for a more serious crime, a felony, and they're serving a sentence for longer than a year. And as you can see by the green farmland surrounding this prison, many prisons are in rural areas, very far from where people live and very far from their families. So there are a lot of differences between jail and prison, and a lot of different kinds of connections between the community and these institutions of incarceration. Now, getting back to healthcare, we talked a little bit about the public health perspective, but there's also a legal perspective to consider, and that is that prisons and jails are constitutionally mandated to provide healthcare for people who are inside. And that's part of why Evelyn knew that she was going to get some prenatal care while she was incarcerated and pregnant. And this comes from a Supreme Court case from 1976 where a prisoner alleged that he did not get adequate health care. His case made it to the Supreme Court, and in his particular case, the Supreme Court said, well, he got adequate care, but they used it as a platform to think about what is the role of the state and what is the role of the prison in providing health care to people inside, to people whom society has decided to put behind bars. And Justice Thurgood Marshall, in the majority opinion, said that the deliberate indifference to the serious medical needs of prisoners is basically cruel and unusual punishment. And so from this moment on, prisons and jails have been constitutionally mandated to provide or to address prisoners' serious medical needs. However, if you're scratching your head wondering, well, what counts as a serious medical need and what is deliberate indifference? Well, then you're in good company. Because as you can see, these are vague phrases, and this doesn't say anything about what services actually need to be provided. And so although there is this constitutional basis for healthcare, it turns out there are no mandatory standards for what healthcare services must be provided. There is no mandatory oversight. And so this leads to complete variability in what healthcare services are present for incarcerated people at prisons and jails. And that is variability in even just what services are provided, but also the quality of those healthcare services. And what this taps into, the Supreme Court mandate and how it gets enacted on the ground, an interpretation of serious medical needs and deliberate indifference, this gets at the tension between what legal scholar Sharon Dolovich has called the state's carceral burden. So what is this, the state's responsibility through its decision to act through prisons and jails, what is its responsibility for the people inside? But on an everyday level, I'm an anthropologist and I study what happens at the everyday level, how people enact this as they make judgments about individual incarcerated people's deservingness of care, and how they decide what kind of medical care this person before them deserves. And you see this tension play out in the interpretation of what counts as a serious medical need and what healthcare services get provided to people behind bars. But what about women's health through this tension between the carceral burden and deservingness? Well, we know that there are, in general, inadequate services provided to incarcerated women in this country. And some people have given the explanation that because they represent a smaller proportion of the overall population, that their gender-specific healthcare needs have been neglected. And some people argue that that's okay because there aren't that many women. But of course, women have some very unique healthcare needs or needs that are specific to them and not to men. And I think one of the issues where this really comes to light is the controversy, and even that there is controversy, over the supply of menstrual hygiene products, pads and tampons in prisons and jails. And at many prisons and jails in the country, women do not have access to an adequate number of pads and tampons. Most of these women, again, are young women. They are still menstruating. And so this leads to women making makeshift sanitary products that are actually unsanitary, or bleeding through their clothes, bleeding all over the place, which presents health risks as well as a threat to their dignity. And this signals the notion that within all of this, males are presumed as the default prisoner. And then when there is something that happens that disrupts this, that reminds people that women are different than men, it reveals that men are sort of seen as the universal default prisoner and women are conflated with them. But again, remember, these are young women of reproductive age. And so the same health concerns that we might think about for non-incarcerated women of this age group also apply to them. And so there are going to be some women who are pregnant at the time of their incarceration. And we know from research that a majority of incarcerated women report being sexually active with men within the 3 months before their arrest. And we know that most of them are not using a regular method of birth control. Ergo, some of them will be pregnant. So how common is it? Well, some of the numbers that are out there, that 6 to 10% of incarcerated women are pregnant, but this comes from a 1990 report from the Bureau of Justice Statistics. Slightly more updated numbers from 2004 and 2005 estimate that 3 to 5% of women reported being pregnant at intake. In terms of births, the only systematic estimate we have of 1,400 births that happen per year to women in prisons comes from an American Correctional Association survey in 1997. And there has never been any systematic assessment of how many abortions, miscarriages, or other pregnancy outcomes happen to women in custody. So essentially, we really don't know how many pregnant women there are and what happens to these pregnancies. Now, my research team at Johns Hopkins is currently working on filling in that gap. We're collecting data from nearly 30 correctional systems across the country at the local, state, and federal level. And we're collecting 1 year of data on pregnancy prevalence and outcomes. So stay tuned for those results, which should be coming out in the next 6 months. PIPSdata.org, Pregnancy and Prison Statistics. So for a woman who is pregnant in jail, what does pregnancy care look like? Well, the first thing you have to ask yourself is, how do they even know? And there are varying policies and protocols as to whether women are even screened for pregnancy, whether they get a pregnancy test. So there's variability in that. And that might mean that someone could be in jail for quite some time before she might know she's pregnant, or before the jail or prison knows she's pregnant. I briefly mentioned the issue of access to abortion, and the the legal record is very clear that incarcerated women retain their constitutional right to abortion while they're in custody. And despite this, many prisons and jails lack a written policy about abortion access, or they might even have a written policy that does not allow women to access abortion unless it's necessary, for instance, to save the life of the mother. But the courts have found that such policies are not consistent with constitutional standards. And women who are in custody are denied abortions. This headline comes from as recently as less than a year ago. And so this is part, again, of the lack of consideration of women's gender-specific healthcare needs and the difficulty in determining what counts as a serious medical need. For women who are continuing their pregnancy, the availability and quality of prenatal care is highly variable. At some places, it's very good. And at some places, it's dangerously neglectful. And although we don't know how often it happens, we certainly hear reports, and there are lawsuits from women whose labor complaints were neglected and ignored, and they give birth alone in their jail cells. And this woman cited in this headline, her baby was born in her jail cell and died and did not survive. If a woman does give birth while in custody, generally, unlike this woman in Texas, she should give birth in a hospital setting, but she's usually not allowed to have anybody with her to support her. There are some doula programs across the country where non-medical but birth support people can be with an incarcerated pregnant woman and support her through the birth process. But those doula programs are few and far between, but they have a lot of benefits for the woman. There's also the issue of shackling pregnant women and shackling them in labor using restraints to restrict their movements. And this is another controversial issue that again taps into that notion that males are perceived to be the default prisoner, because we should not be having a conversation about whether or not pregnant women should be shackled in labor, because the medical risks to that are real. And also just common sense, the chances that a pregnant woman would be able to, in labor, would be able to run off and escape from custody officers that are guarding her is pretty unlikely. And yet these universal rules get applied to everybody. Despite the known dangers of shackling pregnant women and women who are giving birth, there are only 22 states that have laws prohibiting the shackling of pregnant women. And then for women who do give birth, we have to think about, well, what happens afterwards? Where does the baby go? In most cases, the baby will go either to a family member, or if she doesn't have a trusted family member, it will go into foster care. And depending on the length of her sentence, the woman may lose custody rights. We have no idea how common postpartum depression is, but we know that mental health issues are extremely prevalent in this population of women, just incarcerated women. And then add on that the stress of being separated from your baby and have the hormonal shifts having just given birth. And we can imagine that postpartum depression is probably a big concern. But what we're finding in our study is that it's not often talked about or screened for, and that there are issues with addressing those mental health care needs postpartum. And then lastly, to think about is breastfeeding. And are women allowed to provide breast milk to their babies? We know that there are a lot of medical and psychological benefits to women breastfeeding, but it's definitely very challenging to do so in the prison and jail environment. That being said, there are several model programs across the country at prisons and jails where they do facilitate breastfeeding as best they can. And they do this perhaps through some ways are to facilitate contact visits between the mother and the child. And another way is to allow the woman to pump breast milk on a regular basis and then have the milk stored perhaps in the clinic setting, in the jail or prison, and then the person who's watching over the baby has to come and pick up the milk to feed it to the baby. Now, this both contact visits and getting the milk to the baby, it's not just about the woman in custody, and it can be difficult, even in the best of circumstances, to provide breast milk. But another logistical factor is that caregiver, the baby's caregiver, being able to actually get to the jail or prison to bring that infant in for a visit or to pick up the milk. And that's especially challenging when a prison is located in a far away place. So now, coming back to Evelyn and people like her and the ethnographic research that I conducted at the San Francisco jail with pregnant women, with healthcare workers, and correctional officers working in the jail, I want to delve now into some of the contradictions and what I found in my research about how motherhood is managed in jail and the tensions in what someone like Evelyn said. So to remind you, again, she felt like she was at her rock bottom and she wanted to be in jail where she knew she could get some food and rest and some kind of care. And so what I learned from some of the women I took care of and who were in my research, and I should say that it's important to note that this is the San Francisco jail where I did my research, and that there are some basic conditions that are in place, that it's still a jail, but it's probably a more humane jail than other jails across the country. Nonetheless, it is still a place of punishment and people experienced it as such. However, another woman I met, whom I call Karen, she was not pregnant when I knew her. She was in her early 40s, and she was in jail, a place she came to frequently. And she remarked to me after a parenting class that the jail sponsored, which she attended, she said very wistfully, jail brings me back to what being a mother is. Now, that's a very unsettling comment for her to say. She's in jail. She is separated from her children. But in her case, she actually did not have the opportunity to raise her own children because of her struggles with addiction and untreated mental illness and her stints in and out of jail during her younger years as a mother. And now her children were grown and starting to have babies of their own, and she was excited about being a grandparent and getting clean and being involved in their lives. And she appreciated the classes that the jail had and the various activities that reminded her about being a mother and also being surrounded by other mothers. Another woman whom I call Kima, she also had been in and out of jail most of her adult life. She gave birth while she was in custody at the jail. She gave birth at the hospital. And her baby was being cared for by a family member. And her plan was to, when she got released, she was going to go to a residential drug treatment program for moms and babies. And she said she had other children as well who were not in her custody. They were older. But what she said about this pregnancy and about being in jail while she was pregnant, she said, I had a chance to get this one right. For her, she experienced jail and giving birth in jail as an opportunity to give birth without substances. She had been sober in jail, and she expressed a strong commitment to wanting to gain custody of her daughter and to raise her daughter. And she felt like, again, she also attended parenting classes, that doing this and going to a drug treatment program and giving birth without any drugs in her system, this was her chance to get this one right. And she perceived jail as playing a role in this. And on a number of times, Kima said to me this comment, which again, I found deeply troubling, but she said to me, my worst day in jail is way better than my best day on the streets. And again, she went on to say soon after this, but we hate it here because they yell at us all the time. We can't choose what we eat or when we eat. But even with that, her life was so dangerous and so traumatic on the streets that her worst day in jail was better than her best day on the streets. And that is so problematic, and it represents one of the deepest tragedies of our system of mass incarceration that we don't talk about, is how it reflects our broader systems. And yet, these women experienced a version of motherhood while they were in jail. And it is a limited version of motherhood, to be sure. Kima was allowed to see her baby. She had contact visits with her baby about 3 times a week during those weeks right after birth. And she saw her baby, she breastfed her baby, but they were in 2-hour segments 3 times a week. And that's actually a lot for a jail. But nonetheless, she felt that the jail was cultivating her sense of maternal identity. Now, when it comes to other aspects of motherhood in jail, there's also the perspective that pregnant women in jail are what I call hyper-managed, and they experience tremendous judgment. And this relates to deeper narratives in society that have that harshly judge pregnant women, and especially pregnant women of color and pregnant poor women. And we see this manifested in some ways in policies that criminalize certain behaviors in pregnancy. And so, for instance, so many of these women cycling through the criminal legal system struggle with drug addiction. We know that that is a medical condition. There is pathophysiology to addiction and to what happens to neurotransmitters in the brain. It's a complex, multifactorial mental and medical health problem. And yet, for many people, including pregnant women, their struggles with addiction land them in jail rather than in drug treatment programs. Another woman whom I met in jail, Alicia, she was 8 months pregnant in jail, and she remarked about the fact that sometimes the deputies or the correctional officers went out of their way to be nice to her. They would sneak in some extra food, or give her food from their own lunches, or if she was running too fast up the stairs, they would say kindly to her, "Hey, slow down, you don't want to fall." But she astutely remarked, "Is it that they care about me, or is it just the baby?" And this in part relates to the fact that many jails and prisons view pregnant women there as liability risks, that they're just a lawsuit waiting to happen. And many of the correctional officers whom I interviewed for my study revealed this, that having pregnant women there made them nervous because what might happen to the baby? In addition, many of the women I met described feeling judged by other people who worked in the jail. And this replicates, again, judgments of society about who is an appropriate person to be reproducing. And many of these women had internalized broader narratives that made them feel like they shouldn't be having babies. And this, again, relates to broader historical narratives of how the reproduction of poor women and women of color have historically been devalued. And we see this manifested in many ways, but one of them, which I alluded to earlier, is evidence that women in prison have been coercively and without their consent been sterilized. And this has happened as recently as 2010 in the California prison system. And an investigative report found that that over 100 women in the California prison system were unlawfully sterilized without following proper procedure or without obtaining women's consent. And then as recently as July of 2017, a county in Tennessee was instituting a policy where if women or men would undergo sterilization, or for the women get a contraceptive implant placed in their arm, that they would have 30 days shaved off of their jail sentence. And so these trying to entice people to limit and suppress their reproduction by saying they're going to get out of jail is coercive, and also devalues the reproduction of people behind bars. And so these practices are manifested in how people internalize their own experiences of reproduction behind bars, but also in policies that get applied to them. And so I've alluded to my research that is in the book called Jail Care, and this phrase jail care signals all these contradictions and these entanglements of being incarcerated, but also this being a place where care exists, whether it's healthcare being provided, and that may be inadequate healthcare, or it may be healthcare that is better than what someone might have access to in the community, or whether it might be a guard sneaking extra food in for a pregnant woman. There are intense entanglements of incarceration and the punitive logics of incarceration and care in this country. And as part of our understanding of mass incarceration, we have to remember that there are those contradictions, and that is part of the system. Jail care also indexes the fact, as we've talked about, that punitive spaces can also simultaneously serve as spaces of caregiving. But again, it's constrained. These are spaces of punishment. And this is also supported by a recent report from the Pew Charitable Trusts, just released in January of 2018, that discusses the ways that jails have become inadvertent healthcare providers across the country. And again, how that shows the deficiencies of healthcare services and safety net services in the broader community. But as I hope that you have processed and heard me say through all of this, this is problematic. Jail care, this concept that care and incarceration are entangled, it's problematic. It's problematic for someone like Kima or Evelyn or Karen or Alicia to experience jail as a relative place of safety and security. It's problematic for people to rely on jail as a safety net for their medical and mental health provider. And it's problematic to view incarceration as an opportunity. Now, this in no way means that we need to make our jails and prisons harsher. In fact, we need to ensure that people who are incarcerated get the health care that they are constitutionally entitled to, and that their rights to safe and comprehensive health care are fulfilled. And this is especially true for pregnant women. But nonetheless, we should recognize that there are connections between prisons and especially jails and the community that make us realize the deficiencies in how we care for people who are cycling in the criminal legal system. And these are people that we see on the streets. These are not, they're people in the community all around you. We are all part of this reality. So in summary, to revisit some of the themes of reproductive health and what services are provided or not provided for incarcerated women, we talked about how this teaches us about health inequities in our broader society and about reproductive justice, or what we might even say reproductive injustice. And to review, we should remember that prisons and jails are important venues for delivering clinical and preventative health services, including mental health services, but that this is problematic because it means that there are deficiencies and inequities in our community systems. We should remember that incarcerated women have unique health needs that includes access to pregnancy care and family planning services, and that the reproductive justice approach gives us a useful framework to understand what's going on, but also a call to action to understand the intersections among racism, mass incarceration, and reproductive inequities. So with that, I'd like to thank you very much for your engagement with this material. And if anyone is interested, there are many more resources out there to learn more about the intersections of reproductive justice, reproductive health care, and mass incarceration, and also to learn about what standards for health care exist out there. Thank you very much.